I wanted to talk to you about injury recovery and adhesions and how to get over those. This is a depiction of a muscle and the tendons on each end. This isn't really a very accurate depiction, but I'm going to use this as a way of showing you what I'm talking about. When you have an injury, let's say a tendon injury in this case, you will have a lot of scar tissue build up over that area. And if you're like a lot of people, then it's a situation where that scar tissue lays down, especially initially, in a very haphazard manner. Your tendons, the fibers kind of run in one direction, and that makes your tendons and ligaments and everything else extremely strong, like a rope that has all the fibers going one way. It's extremely hard to break that sort of thing. But when you're injured, oftentimes your body lays down scar tissue and adhesions in a very unorganized manner. And when it does this, it may heal quickly, but it doesn't heal well and it doesn't heal strong. And there's a number of things that you can do to help this and make sure that your body kind of recovers from this kind of thing here. And another problem when you have this kind of adhesion is it can become very dense. You have an injury and the body says, hey, we need to restore the blood supply, restore the nerve supply. But sometimes it happens where these fibers get laid down first, and then the nerve supply and the blood supply they can't get into where they want. So sometimes the nerve supply becomes overactive on the outside. In other words, the body keeps trying to get a nerve supply in there, but it can't, so it'll send more nerves, and that will make this area hypersensitive. And you probably have heard of having like I had an injury back in high school and it really bothers me ever since. Or every time the weather comes through, even a tiny change in barometric pressure, I can really feel that old injury that I have, that sort of thing. That area becomes very, very sensitive. And this technique will help that as well. I'll show you what I'm going to be recommending. I would recommend that you purchase a couple things. This is a roller. You can get these things on the internet or at a running store, but they are really, really great, especially for larger muscle groups. They're great for the legs, and a lot of runners use them, your quadriceps and your hamstrings and your calf muscle and that sort of thing. It's a little bit harder to use this sort of thing like on a shoulder or an arm. You can't get enough pressure with one arm to do the job. So for those kind of areas, I recommend, and this one I got off the internet. It was not very expensive. I think it was like $30 or something like that. It was really kind of a cheap model, but it works great, works really good. And I actually need to charge this one here, but it has a repeated kind of massage type thing. Now I have a very small head for a concentrated area where the pressure is going into, and you would find an area that has this scar tissue, and what you want to do is break that up. Like I said, have been in practice 36 years. I retired recently and stopped doing chiropractic, which was very, very hard on my shoulders over that length of time. And for that was a couple years ago. For the next couple years, I've been working on getting my shoulders better, and they're immensely better than when I first retired. I was going to say graduated, but anyway, what you want to do is break down adhesions slowly and gradually, but painfully. Why do I say that? Well, an adhesion like this, because of the nerve supply issue, tends to be quite painful. Oh, that's sore. That's a sore area. That's tender. That is an indication that you need to work on that area. If it's a musculoskeletal problem and it's tender, and it's not just an acute injury that just happened the other day, it's something long-term, that's an indication that this technique is going to help that area. So use this technique liberally, for sure. Do it slowly and gradually. Like I said, I've been working on my shoulders for a couple years now. And I do it about 3 times a week. I work on both shoulders, and I get in and find those tender areas, and I go pretty hard on it. And it is, if it doesn't hurt, you're not doing it hard enough, or you're not in the right area. One of those two things. Get in there and break up that fibrous adhesions, break up that scar tissue. This will allow the fibers, that you break the fibers and your body lays down new ones, but they lay them down along the lines of stress. I'm using my shoulders, I'm exercising them, that sort of thing. And my body is laying them down along the lines of stress. So instead of this weak adhesion that keeps tearing and tearing on a microscopic level, you've got fibers that are laying down along the old tendon lines, and it's much, much stronger than it used to be. So keep this up. Do it gradually, do it slowly. Don't expect overnight relief, but sometimes you can see a difference fairly quickly. But get in there and really do that. Now, that brings something else up. Oh, that's a tender area, I'm going to massage it. Something like this isn't cutting it. You've really got to, and you can use your hand if you want to. You can use a device like that, or they've got lots of different things out that you can do. I like this massager because it is very effective. You can use your fingers and get in there, but if you're not causing yourself discomfort to some degree, then like I said, you're not in the right place, or you're not doing it hard enough. Perform it 3 times a week. Give your body a break, a day in between, so that it can recover. That area isn't just constantly being broken down. It's breaking down the adhesions and repairing with new tissue, and breaking down the adhesions and repairing with new tissue, and so on. Ice it daily if it's acute, inflamed, or painful. Now, if it's a new injury, you don't want to go in and digging on it and that sort of thing. You want to give it some time to heal up, but start using it if it's a new injury. The body has the ability to know where the lines of stress are, and if you put it in a sling and don't ever use it, and I haven't moved this thing since I injured it 6 weeks ago, you're going to have some real problems with your recovery, because your body just lays down scar tissue everywhere in there. And if you start using it, and this is provided you don't have a broken arm or something like that, if you start using it and moving it right away after an injury, you're going to recover better. They've done a bunch of studies on this. And then make sure that you support your nutrition, especially your adrenal gland. The adrenal gland has a lot to do with collagen production. And if you're breaking it down and your adrenal glands are already tuckered out, then you're going to be in a situation where it doesn't heal very well. So you can't recover from injuries like you should. So anyway, these are some things to do. Keep this in mind. Be persistent with it. And good luck. And that's what this program's about, is getting over this kind of an injury.